According to the Canadian Nurses Association, evidence-based practice began with Florence Nightingale in the 1850s. She noticed death rates of soldiers were higher when the sanitary conditions of hospitals were poor. Observation and knowledge about the factors that impact health outcomes is critical. As was the case for Florence Nightingale, understanding the correlates of health outcomes can change how a treatment is applied without actually changing the treatment itself. This is especially true when it comes to mental, behavioral, and cognitive disorders, conditions whose onset and progression depend on any number of biological, social, and psychological factors. How well exposure treatment works for a simple phobia, for example, will depend on how completely the psychologist and patient understand it. Florence Nightingale's experience also shows us how we must continually monitor health outcomes because they are impacted by their changing contexts. That is something that progress monitoring and psychological interventions has understood so well. It also shows us that the importance of clinical information to patient outcomes cannot be underestimated. Seligman pointed out many years ago the important difference between effectiveness and efficacy in treatment outcome research. The many factors that impact health cannot always be controlled, which is why the effectiveness of a treatment, rather than just its efficacy, is very important to clinicians. It is also why practice-based research is as important as research-based practice. Psychologists, I believe, are uniquely trained among health providers to understand the importance of research to the clinical enterprise. Most with master's and doctoral degrees have training which is academic in its foundation. This prepares us to ask questions and apprehend the range of factors that impact the problems our patients and clients present. Our professional training, on the other hand, demands that we also assist in solving those problems. And ultimately, that is the objective of any health intervention. As an organization, the Canadian Psychological Association often talks about psychology through its three pillars: science, practice, and education. In reality, these are not so much pillars as lenses that are inextricably intertwined, lenses through which every effective psychologist must strive to understand problems and contribute to their solutions.